name is Chris. I'm a registered massage therapist, and in today's class we're going to be covering how to palpate the body, more specifically how to palpate soft tissue, how to palpate the joints, the bones of the body. But what I do want you to keep in mind is that this isn't an ideal platform to teach a kinesthetic skill. You don't want to be doing this over video, but because of COVID-19 we can't do this in a class format. So consider having a body next to you, a body that you can practice these skills on. So another thing I want you to keep in mind is that when we are palpating, this is more of a pro tip I'm gonna give you, but muscles don't always go in a straight line, and what that means is that sometimes we have muscles that travel horizontally, maybe on an oblique angle like your traps, or maybe they are going up and down from origin to insertion. So the idea that I want to share with you is that maybe you might want to cross fiber palpate. In other words, if the muscle is going up and down like this, a cross fiber palpation means I'm going to go this way so that I can confirm what structures I'm on. Another idea I want to share with you is that if you're having a hard time identifying the muscle that you're on, contract the muscle. So you're going to have a strong understanding in anatomy, theoretically, if you want to become good at palpation. So keep in mind that theoretically, anatomy might make sense, but practically it's a whole other skill. So stay tuned for the list that we're going to be covering for palpation. First on this list, we're going to be covering C7. Now, the idea with C7 is that it can get a little bit tricky because C7 spinous process can get confusing with T1. They kind of have this overlapping or this neighboring relationship. So when palpating C7, you want to come to the upper trap area, and by roughly palpating this region right here, you're going to have two bony prominences sticking out, right? So C7 spinous process is a bone, it's not muscle. So you're going to have a bony prominence sticking out. How can we differentiate? If we have C7 and T1 both poking out, it's hard to differentiate. How can we theoretically figure out which one is which? The idea is that C7 is not restricted by the ribs that attach to it. So if we understand our anatomy, C7 is part of the cervical, it's part of the neck. So the difference being T1 has rib number 1 that wraps around from the front, anchoring it down. So by introducing a bit of movement, we will see that C7 will start to move, but T1 is anchored down. So to palpate, what I'm going to get you to do is to look up and down, okay? And it becomes very obvious once we introduce movements, right? Can I get you to look left and right? C7, I can confirm based off movements. It's roughly around this area right here, okay? So once again, look left and right, up and down. Perfect. We are on C7, and that's how you would want to find using motion to differentiate between C7 and T1. Next on this list, we have the scapula, more specifically the medial border and the inferior angle of the scapula. So it depends on the bodies that you're working with. Some body types, it's very obvious that you're on the scapula. You can almost visually see the scapula moving, or basically, even at rest, you might be able to identify where the scapula is. But once again, using movement, we can use it to our advantage to get our client to internally and externally rotate to identify we are on the scapula, we're on the medial border, and we can find the inferior angle. In other words, Jay, can I get you to do this? Bring your arm behind your back. Perfect. Compare this side to this side. By getting your client to internally rotate, what happens is that we create winging of your scapula. Now, how to palpate the scapula? You want to find the back, go on the posterior surface of your client. It's very obvious we're on the scapula, but the medial border is the medial part of the scapula right here. We can palpate this. It's positioned like this, vertically. If you want to confirm, we can go horizontally, and we will go on the medial border and fall off. It's going to kind of feel like you're rolling off something, okay? So we're right here. This is where the levator scapula attaches. Rhomboids come over here, and you can see the outline right here. This is the inferior angle. So once again, similar to C7 T1, if you cannot differentiate, use movement and you will have a better time identifying visually and with your hands, with palpation, what exactly you're on. Next on this list, we have your traps. Now the thing with this muscle is that it can get a little bit confusing because it is such a large, wide muscle, but Understanding your origins and insertion will help you practically palpate on the body. For example, your traps, there is 3 different muscle fiber types, okay? Well, not types, different muscle fibers that will allow you to engage the muscle, therefore confirm that something's contracting, I must be on the correct structure. For example, we have your upper fibers. The insertion, right, ranges from the lower back, origin is at the base of the skull. So at superiorly, we have the external occipital protuberance. If you feel for the back of your head, there's a little bone that sticks out, right? That's the superior attachment for your traps, and it'll come down on the spinous process of the spine, down to T12. But now the tricky part is that as it spans all the way down, depending on the segment that we're on, the muscle fiber directions change. Superiorly, it'll go on an angle like this, reaching up to the acromion on the shoulder. Medially, the muscle fibers are more straight in a horizontal plane. Inferiorly, we have the muscle fibers shooting upward and kind of curving laterally. So we have this meshing of muscle fibers as it spans across the body. Now, how can we confirm if we're on the traps? Superiorly, what I want you to do is to look up with your head. Now shrug your shoulders. Good, so shrug your shoulders going upward. Because we know origin to lateral insertion, the muscle fibers are going in this plane, therefore contracting here to here will create a shrugging action. Okay, so to palpate, relax. To palpate, the muscle fibers are going to go like this. To cross fiber palpates, we're going to want to palpate coming in this direction, and right away it becomes very obvious we are on the upper traps. Okay. Once again, to the back of the head, we have the external occipital protuberance. At the midpoints of the muscle, this is our fiber direction, okay? To cross fiber palpates, we're gonna switch from here to coming in this angle. Now, contracting origin to insertion, here will create retraction of the scapula. Perfect, and we can see muscle development here. Relax. To palpate, we're gonna come cross fiber. Right here. Retract your shoulders. And right away, if you're suspecting that you might not be on it, just resort back to the theory. What is the origin? What is the insertion? Can I get it to contract? If you are feeling the muscle engaging, you are likely on it. Moving forward, inferiorly, relax. Inferiorly, it's a bit more tricky. We're going to activate the trapezius using a stabilization technique, which is a overhead reach. What I want you to do with this arm is reach above as if you're reaching for something above your head. Perfectly. Now, I'm not sure if you can see this, but with the lighting that I see here, I can see perfectly the outline of the trapezius going in this direction. Once again, to cross fiber palpate, I don't want to go like this, but I'm going to change my angle. And if you can see this very subtly, right here, and I'm sure you can feel that, we're rolling on and off the muscle. That's medially, comes across the acromion, relax. And once again, to engage the muscle depends what part of the body we're talking about, and that's how to palpate the traps. Next on the list, we have the erectors. Now, the tricky part and the thing that you have to understand regarding your erectors of the spine is that it's actually 3 different muscle groups, right? So within the vertebral columns, we have the vertebrae, and in each side we have these huge pillars of muscle to help erect the spine, hence erectors. But each muscle group in itself, we can further break them down into 3 segments, specifically 3 different muscles within each column. We're not going to go that far because that is hard to palpate, but theoretically you just want to keep that in mind. How to palpate the erectors? They, from origin to insertion, they help globally to erect the spine. So if you can get your client to look up, good. If you can get your client to push their chest forward, extending their spine, so sit up, sit up, sit up, sit up, sit up, sit up. Once again, I'm not sure if you can see this with the lighting that we have here, but there is a nice outline of each column you have on the spine here. So now we know the anatomy is going up and down in this plane. To cross fiber palpate, we want to go in this direction so we can confirm. Relax. Okay, look up, extend your spine, push your chest forward. Okay, so how do we confirm? We are getting a nice solid contraction right here with the erectors, and I can confirm because most other muscles here don't necessarily help with as a primary movement for thoracic extension. So we can confirm here we are on the erectors coming up over here, coming up over here, coming up over here. If the traps were involved, we would have to get retraction of the scapula. Once again, I can confirm I'm on the erectors. Coming up, coming up, coming up. As we get to the cervical vertebrae, it's important that you make sure that your client's looking up, because that's a form of cervical extension, okay? Which is why having a desk job and having your neck like this leads to a tight neck. Look up, palpate, palpate, relax. Once again, using contractions, using your anatomy, your understanding of anatomy to confirm we're on it. Look up, okay, relax. From cervical down to the thoracic spine, down to the lumbar spine, it's basically helping with extension. So once again, if you do want to confirm, cross fiber palpate in this direction because the muscle's going like this. Cross fiber palpate, and then get your client to look up and extend the thoracic spine by cueing them to push their chest forward. And that is how you palpate the erectors. Next on the list, we're going to be palpating the iliac crest and L4, L5. Basically, to palpate the iliac crest, you want to take your hands, put them towards your side, and it's a clear indicator, because it's not soft tissue, it's bone. You're not going to get a contraction out of this, but you're feeling for a very dense, kind of like knocking on your elbow, right? A very dense sort of sensation with the fingertips. So to confirm, you want to take your hands, you're going to bring them to your side, right? So the iliac crest comes like this. What I want to do with my palpation is either go vertically, or I guess follow it posteriorly, horizontally, right? So right here, I can confirm I'm on the iliac crest. So it's going to be what I do here, I'm going to find exactly on the opposite side. It goes from the front. We have the AS-IS in the front, iliac crest, and then we have the PS-IS over here on both sides, and that's the dimples that you find on most people right here, okay? So now, the reason why I'm giving you this anatomy is because if we continue to go medially, we will find right here, that is your L4, okay? So once again, if we palpate the iliac crest, we move posteriorly, we have L4 right here, and next on the list is L4. That's where you find the spinous process of L4, and if we can find this, if we move inferiorly, we will find the spinous process of L5, okay? So this is a very straightforward one. Like I said, we're not using muscular contractions because we don't need that. We don't really need movements to identify this, but we're identifying it based on the characteristics of what we're feeling based on our palpation, okay? Iliac crest leading to L4, and if we move inferiorly a centimeter or two, we will get to L5 spinous process. Okay everyone, so that was it for today's class. It's a very quick and simple list. I want you to practice it because like I said before, and what I found as a registered massage therapist is that what I learned in theory was very hard to translate to a practical, to a body. So it's not something you can just visualize. It's good to have a theory, but you do want to practice palpating on an actual body. So we're not in class. Grab a friend, grab a sibling, grab your mother, grab your father, and practice it, because you will find the more that you practice on different body types, the better the palpation skill will develop.